Bado tuko tu hapa Hill Park na mbogi yangu. Mbogi yote leo haiko. Lakini next time tutahakikisha mbogi imefika yote. Recapping bado. Kuangalia comments, zile vitu ziligenerate a lot of interest, a lot of controversy. Controversy ikue nyingi ama tupunguze.
Vile itakuja tu.
Venye itakaa. So long as tunasema ukweli ni sawa. Ningependa bado tukiendelea na historia ya pregnancy complications. I mean, one of the biggest reasons, kuna mtu alisema pregnancy is a normal thing. It is a normal occurrence. And often mali ambapo medical practitioners wanatakikana kustep in ni zile zimekuwa complicated. What are some of these common complications in pregnancy? Tuambie tu zile 3-4 hivi zenye kama uko job ukisikia hii pia wewe tu na
Okay, so vile umesema there are very many pregnancy complications, but tutaongelea pressure or it's called hypertensive induced in pressure or pregnancy induced hypertension, whereby your pressure imeenda juu kiwango ya juu ile ambayo haistahili uko na mimba. How we diagnose ni kwamba utapimwa pressure sasa ile umekuja clinic kuangaliwa for check up na pressure yako itakuwa iko juu. Kuna level ambayo tunaangalia na tunasema hii pressure iko normal, hii pressure haiko normal.
Okay.
Now, if your pressure is just high without any other thing, then we say that is just pressure. Now we have what we call preeclampsia. Na preeclampsia sasa ni kwamba pressure yako iko juu, then when we check your urine, you're actually also producing protein. Sometimes ukiangalia mwili, most of the time what we call the cardinal signs ni kwamba you will be having edema ama kufura. So utafura uso, utafura miguu, utafura mikono, yeah? And those 3 things, so high blood pressure, you're having protein in urine, and now you're swelling up, yeah? So you're having edema. Those are cardinal signs ya sisi kusema kwamba huyu ni candidate wa sasa preeclampsia. Now preeclampsia ikicomplicate zaidi, unakuwa na kitu tunaita eclampsia. Na sasa ukipata eclampsia, this is now fitting, whereby you're fitting or having conversions,
kifafa ile kunini
kujak na kutupa mikono kuanguka. So your pressure imeshaenda juu zaidi, you're emitting a lot of proteins, yeah? So all this of course has an impact to the baby. Remember, if your pressure iko juu, inamaanisha hata mtoto hapati kiwango ya blood ile anahitaji oxygen, nutrients, kila kitu inakuwa impeded, yeah? Of course we have anemia. There are so many things, we can't talk about all of them. There's also anemia. As Fellow said, anemia is very crucial when it comes to pregnancy. Because with lack of iron or when your blood level is low, one, there's pure perfusion, yeah? So oxygen is not being transferred to yourself, to the body parts, and now to the baby, which now eventually leads to either a miscarriage, a stillbirth, which is very sad, because imagine umebeba pregnancy alafu you come and end up with a baby who is dead, or you don't get to full term. Yes. So those are some of the things I can discuss. Of course there are others, very many, cardiac, kuna vitu nyingi, diabetes.
Tukiangalia hiyo hapo hypertension, na I mean tunajua venye tunasemanga hypertension has no symptoms. Hypertension is a silent killer. Na kuna watu wenye wanakujanga wanakuambia, umeketi hapo consultation room, anakuja na kuambia kichwa yangu inauma, kwa hivyo pressure iko juu. Ama venye ulinipea dawa, venye nilitumia, kichwa iliacha kuniuma nikajua pressure imerudi chini. So what would you advise those people? Umekuja umeandikiwa dawa ukasikia headache imeenda, ama ulikuwa umefura ukaona sasa sijafura, what would you tell those people?
No, what I can say and what we always tell our mothers is it is very important for you to keep on coming for checkup. You know, the only way that utajua kwamba kweli pressure imeshuka chini ni kuwa utangaliwa. And so if your pressure is consistently low ama imerudi back to normal, daktari atakuambia sasa tuta step down dawa, ama eventually we will just be on a diet. Of course we also refer these patients to the nutritionist, because remember nutrition na diseases zina go hand in hand. Yes. Hakuna vile utameza tu dawa na useme sasa utapona, you're not going to check on your nutrition. So fellow has to come in. You have to refer these patients to fellow. So that is he's also telling them probably reduce your sodium intake, reduce your fat intake, cholesterol iko juu, we need to do something about it. Yes. So I think it is very important not to just stop your drugs just because leo umesema ati ulikuwa na headache, ilikuwa severe. There are so many things that causes headache just besides pressure. Hata anemia inafanya headache because oxygen is not being perfused to your brain. So headache is not just a one symptom that you can say inasema ni pressure. Hapana. There are so many other things. Yes.
Traditionally kuna vile tunasemanga that hypertension does not have symptoms. It has complications.
It has
By the time
bad
unasikia
complications.
kitu
Yes.
inamaanisha
It has already
imeshaenda kabisa. Fellow, umeongelea about pregnant women, the nutritional advice and all that. Mama mwenye yuko na hypertension in pregnancy ama diabetes in pregnancy, ana stick bado kwa hiyo advice ya mwenye ana complications, or is there something extra ambayo mnaongeza?
Now the advice for a normal person ni kama kusaidia mtu normal na mtu mgonjwa is completely different. When you come to a level where now you have a complication such as that diabetes or hypertension, the diet changes. So the food groups remains the same, but your portion will be changed a bit. Kama yule wa diabetes will tend to reduce things that will tend to raise these sugars most. Na hizi ni starch. So but we'll still put in the mind that your calorie requirement goes high. I remember there is a question you asked me about calories. A pregnant mother first trimester require 300 more. Actually first to second trimester. Daily intake 300. Kama alikuwa na calories are energy, inasaidia mwili kufunction. So ile chakula unakula per day, ile energy ilikuwa inakupatia kama hauko mjamzito, unahitaji 300 more. Then the second last trimester sasa unahitaji 400 more. Now if you are hypertensive, one of the factors we'll check because you have been coming for weight checkup. If your weight is increasing excess and weight increase, like I always tell patient, a pregnant mother should increase in weight with 0.5, actually with the 200 grams to 500 grams per week. That is amounting to around 800 grams to 1 kg every month. And a total pregnancy you should have increased with the 12 to 14 kgs. Now if you have said
so how ni wale
normal pregnancy
weight.
Yes,
normal
if you are
weight,
normal
normal
weight,
BMI.
yeah, normal BMI. Kwa wale underweight, there is a weight you should increase with. But if you have a normal BMI and you are increasing in 2 kg, 3 kgs, we'll tend to ask you what is happening. Are you excessively feeding? And if you're excessively feeding and you are hypertensive, then we'll reduce your portions. And if you are just normal BMI, there are things that are necessary for blood pressure control. And one of these is electrolytes. And one of them is sodium chumvi. So we'll tend to lower your sodium intake to a relative amount ile inahitajika. And if you have edema, mguu imefura or anything, then we might exclude it for some time because itafanya ufure excess. Then fats also tend to block your vessels. Zinafanya zile mishipa za damu zikuwe nyembamba. So we'll tend to help you also lower fatty food. Tutakataza zile masamosa unakula, machips unakula, zile sausage, bread spreads zile unapaka pale kwa mkate, na kama ni mafuta kiwango fulani yenye utatumia. Ndio ziwe ile cholesterol. Na pia unapata kwa ukiwa na pressure, kuna usuizi ama kuzuia kwa damu kutembea kwa mwili vizuri. Ndiposa mama mjamzito anapaswa kuambiwa zile exercise anapaswa kufanya ndio imsaidie damu kutembea. Na diabetes pia vitu na maji, sukari, portions pale na vitu mingi tutakuwa advice.
Good. Sasa kuna swali hapa moto ni kama zile debate za primary school. Nilikuanga mtu wa debate. Nimekuja kutetea huu mswada. Sasa hapa kuna mswada. CS versus normal delivery. Tukifunga briefly. CS versus normal delivery. Can we say there's a better mode of delivery? what's your Karoto ambia
From the
alafu pia
midwife.
mimi nitasema
Yes.
alafu tuone.
From the midwife perspective, ni kwamba there's no preferred. Let me start by there's no what preferred, whether it's normal delivery or cesarean section. Kila kitu iko na side effect yake. But for sure normal delivery is the best. Hakuna vile ungetaka just to go to theater for an operation. You might die in theater. You might bleed. There could be other complications with the anesthesia. You know, like even you waking up, whether it's general or spinal anesthesia, you're nursing a wound. It's a wound. You need to nurse and take care of it. There's also complications like throwing an embolus or a clot. So for me, I would advise normal delivery at any time. And within 2 to 3 days, umeshapona. And you're able to go back to your activities.
Sharudi kuchimba
Kitambo hata
waru.
ukiangalia, yes, that's what I wanted to say. Kitambo in the olden days, actually ulikuwa unazaa na after some days umesharudi.
Umeenda kukamua ng'ombe.
Umerudi kukamua ng'ombe.
Naweza ongeza kitu daktari?
Yes, briefly.
Yes, briefly I will say normal delivery or versus CS. For me, I would say it's individualized decision because you have two reasons why you don't want normal delivery and you prefer CS, or why you prefer normal delivery than CS. But the most important thing, if any of them is done under a place or with a personnel who knows what they are doing, where you are sure with whatever is going to be done, then both of them are safe. But in a normal African understanding, I would still say normal would be much better than CS because there are hormonal changes that the body will detect that something has happened that should not happen in a normal way. So yes, everything will be normal, but on and off ushasikia hawa mama wamefanywa CS wanasema kukiwa na baridi anaumwa hapo chini.
Now,
things like that.
What would you tell us?
As we close.
Yes.
Your topic ni moto. Lakini last time venye tu close show tulisema the most important thing about any pregnancy ni healthy mother, healthy baby. Kama ni normal delivery, let it not be at the expense of the safety of the mother and the safety of the baby. If it is CS, let it not be without indication because of the potential for complications. Tungependa kufunga hapo. We hope to address most of your queries. Lakini tutazidi kuku-encourage through our social media handles. Give us feedback kama kuna swali ambayo labda uko nayo, kuna kitu imesemwa, you'd like to get, clarity about it. We'd encourage you, please follow us, please comment. Na tukiwa hapa Hill Park Hotel, tunasema enjoy your Saturday evening. Asante sana.